So now you had spine surgery and the pain comes back. Or it really never went away. Now you're wondering, did something go wrong? Was it the wrong surgery? Or is this just a new normal? That feeling of dissatisfaction, frustration, confusion and helplessness is something I've seen in many patients. And if you're going through that, let's clear things up. Starting with the truth about something called as failed back surgery syndrome. Hi, I'm Dr. Arvind Kulkarni. I'm a consultant spine surgeon with a focus on minimally invasive and endoscopic spine surgery. Today we are going to talk about what failed back surgery syndrome is, why it happens, and it's not always surgical failure, what your next step should be if you're still in pain, and how modern approaches including MISs can help even when a previous surgery didn't. So let's delve into it. So what is failed back surgery syndrome? FBSS is a term we use when a patient continues to experience back or leg pain after spine surgery. Now let me be clear, it doesn't always mean the surgery was done incorrectly. It simply means the outcomes did not match the expectations. The pain either didn't go away, came back, or even got worse. For the patient, it's frustrating. For the doctor, it's a red flag to reassess the full picture. So there are several reasons FBSS can occur. Wrong diagnosis, wrong level of surgery, the surgery didn't fully decompress the nerve, where instrumentation and stabilization was necessary but was not done, poor surgical planning, performance of an incomplete or a wrong investigation, and sometimes a new degeneration develops at the neighboring levels, which are called adjacent levels, over a period of time. Sometimes the structure is fixed but pain signals remain active due to nerve sensitivity or poor post-op rehab. This is why diagnosis matters just as much as the surgery itself. And you absolutely must go to a seasoned spine surgeon who has a lot of experience. What can be done about it? Here's the good news. FBSS doesn't mean you're out of options. First, we do a fresh and thorough evaluation with a meticulous approach, often with updated imaging and a clinical examination, making sure no stone is left unturned. We identify the pain is due to nerve compression, mechanical instability, scar tissue, or something else. From there, the treatment plan can be tailored. Common options include epidural steroid injections to reduce inflammation and post-op nerve irritation, endoscopic decompression, a precise way to release pinched nerves without extensive dissection, stabilization procedures including fusion if there is a structural instability, and as a last resort, neuromodulation is an option where spinal cord stimulation is done in select cases of nerve-driven chronic neuropathic pain. Every case is approached individually and we always aim to use state-of-art minimal access techniques whenever possible. But if the condition exceeds the limits of minimally invasive surgery, we proceed with open surgery only when necessary and always with the patient's best outcomes in mind. Can FBSS be prevented? Sometimes yes, and it starts with precision at every step, accurate diagnosis, appropriate investigations, clear communication and realistic expectations, surgical planning matched to the patient's condition, and most importantly, the right infrastructure and a very well-trained surgical team. Spine surgery is technically demanding. Success depends not just on what's done, but how well it's done and where it's done. We always aim to use minimally invasive techniques when possible, but more than the method, it's the judgment, preparation, execution that prevent failure. If you had spine surgery and are still living with pain, I want you to know you haven't failed and your surgeon hasn't failed either, but something may have been missed in the diagnosis, in the planning, or in the execution. That's why we go back to the basics: accurate evaluation, appropriate investigation, and a surgical approach supported by experience, planning, infrastructure, and precision. And that's the difference between doing surgery and doing it the right way. Like this video if it helped clarify your concerns. Share it with someone still searching for answers, and follow for evidence-based, honest spine care that puts clarity first. I'm Dr. Arvind Kulkarni. I'll see you in the next one.